to be here today with you and with all the participants. Many of you have glaucoma, and many or a family member or friend with glaucoma. And I'm glad we're together to talk about dry eye and glaucoma. This is a picture of a patient with dry eye disease just before I checked her intraocular pressure. When we put the fluorescein in the eye to get the eye pressure, I almost always take a look at the tear film. And I've learned a lot over the years of looking at the tear film over and over again. This particular patient has a lot of dye uptake in the epithelium, which is a little denuded. And I describe this to my patients as it looks like someone threw a handful of sand at your eye. And often that's what it'll feel like to the patient as well. So one thing I like to say to my colleagues if we're talking about dry eye and glaucoma, I say, oh, everybody with glaucoma has dry eye syndrome. And that's actually not quite the truth. But if we look at the data, if you look at multiple studies that look at the percentage of dry eye in the general population, it runs between about 5% and 50% of people have dry eye syndrome. Whereas if you look at a population of glaucoma patients, the various studies quote between about 40% and 75%. And so you can see that dry eye is much more common in our glaucoma patients. So the question is, why is that? And there are several factors that contribute to that. And one is that the prevalence of glaucoma increases with age. So glaucoma is an age-related disease, which means that it's more common in people as we get older. And the second part of that is that it's also a chronic disease. So glaucoma tends to get worse can sometimes get worse or be more of a challenge as we age. And the same is true of dry eye disease, that it's more common in people as they age, and it's a chronic disease, so it may get more challenging to treat over time. And what's interesting about both glaucoma and dry eye disease is that we want to treat them effectively as early on in the disease process as possible. So aggressively treating glaucoma early and dry eye disease early makes them less troublesome diseases later. But the really interesting thing about these two diseases, which are intertwined, is that the treatment of glaucoma often makes dry eye disease worse. So it's very challenging, and we have to work on the two in tandem. This is another photo taken just before a pressure check. And you can see here that there's not all that dye uptake, and yet the tear film isn't nice and smooth like we want it to be. And in this picture, you can see that the tear film is a little irregular. And we call this a decreased tear breakup time, meaning that you have right after you blink, you have a nice, smooth tear film, but that very quickly that tear film breaks down. And this patient might not complain that it feels like sand was in my eye, but this patient might complain that, you know, doc, my eyes just feel tired all the time. Or when I start reading, I can read for a while, but after a time, I just get so fatigued. And that's because the tear film isn't as dense and lovely, and you get these little dry spots. Another common complaint from my patients with dry eye is that my vision fluctuates so much. So when someone says, you know, sometimes my vision's crystal clear, and other times I just feel like I can't see, that's a clue that a patient might have dry eye syndrome. Another very common complaint is that the vision's blurry, and I'll ask, well, if you blink, does it clear up? And if the patient says, yeah, when I blink, the vision clears up, then that's almost always a sign of an ocular surface problem and not something inside the eye, which actually makes me very happy because it's a problem or pathology on the surface that we can address and isn't a problem with the back of the eye, say in the macula or the retina. why do we care about dry eye syndrome? Why is it a problem? And I really see three issues. And the first one is a quality of life issue. So if your eyes are fatigued or tired or you can't see, it's really about quality of life.